course, we see outbreaks of diseases that we thought were relegated to the pages of history, hospitalizing and killing some of our youngest Texans. But even as we acknowledge these challenges, we must recognize the solutions within our reach. I look forward to learning about these solutions through this committee. We have hard work ahead, but we also have the expertise, the passion, and the commitment to build a healthier Texas. Members, I look forward to working with you, and I look forward to working with the healthcare professionals, advocates, and most importantly, the people we serve to find real solutions. As we begin our work, I would like to introduce the people who will be helping us accomplish our goals this session. Our committee clerk is Scott Crownover. Assistant clerk is Alex Maldonado. And from my office, Trish Conrad is Chief of Staff, and our policy director is Aaron Tarabella. Members, are there any additional comments before we begin our agenda? Very good. We will only be taking invited testimony today. If you are testifying, please make sure you have filled out the electronic witness affirmation form on the registration kiosks in the hallway. Today we'll be discussing several items, general items that relate to our committee. We have invited testimony to begin with the Texas Department of State Health Services, the Health and Human Services Commission, and then we will hear from a few other invited witnesses. We'll begin our meeting this morning with a report on the measles outbreak in the South Plains and Panhandle area with the Department of State Health Services. Members, I want to let you know that we also have a couple of resource people in the room. We have Blair Walsh, who is the Assistant Agency Director from TDM, and Alejandro Delgado, Deputy Commissioner of Operations from TEA, will be here as resource witnesses. At this time, Chair calls Dr. Jennifer Shuford. Dr. Shuford, please state your name and position. Since this is an organizational meeting, you will be classified as neutral concerning your testimony.
Thank you, Chair Van Dever. I'm Dr. Jennifer Shuford. I'm Commissioner at the Texas Department of State Health Services. Thank you so much for inviting me here today to give you an update on what's going on with measles, especially in the Panhandle and South Plains region. I believe you have a handout in front of you, and I'll be going through those slides today, and I'll start with background. So, measles is highly contagious. It's probably the most contagious virus that we know of. It's spread by respiratory droplets, like flu or COVID is, but it's also spread by the airborne mechanism, much like tuberculosis, where measles can hang in the air like tuberculosis does, and it can hang in the air for hours. So we know that measles can stay up in the air for up to 2 hours and be contagious over that period of time and can infect people who enter into that airspace. Up to 9 out of 10 susceptible or unvaccinated people will become infected if they're exposed to that measles virus, so it's very contagious. The best protection that we know of against measles is the mumps, measles, rubella vaccine, or MMR. So this vaccine provides really long-lasting protection against all strains of measles. And the MMR vaccine has been in use in the United States for over 50 years, so it's got a long track record. I'm going to the next slide, which talks about measles symptoms. So with measles, once somebody gets infected, there is a fairly prolonged incubation period. It's about 10 to 12 days, and then they start to have symptoms. And those early symptoms include kind of a moderate fever, cough, runny nose, red eyes, and sore throat. So it starts to present like a respiratory illness. And then after a few days, those infected individuals will get a higher fever. It can go to 104 and 105, be really high. They'll start to get that rash that's classic for measles, where it starts usually up on the hairline and then travels down the body. It kind of is red and then turns red-brown. And as I mentioned, it takes about 10 to 12 days before any of those symptoms starts, and it takes about 14 days before that rash starts. People are infectious from 4 days before that rash starts to 4 days after that rash starts. starts. So one of the reasons why we're so concerned about measles is that there are complications that come frequently with measles infections. So they can cause serious health complications, especially in children under the age of 5, and really in those that are under the age of 1, pregnant women, and people who are immunocompromised. And so when we look at all the people who get sick with measles, about 1 in 5 will need to go into the hospital. So about 20% will be hospitalized. About 5% will get the complication of pneumonia. And rarely measles, it's about maybe 1 in 1,000. Measles can cause swelling of the brain, encephalitis, and can cause long-term neurological complications from that. It can also cause death. About 1 to 3 in every 1,000 people who get measles will die. In addition, for pregnant women, it can cause pregnancy complications like premature birth and low birth weight. There's data that also shows it can cause miscarriage. So let me talk a little bit about specifically what's happening in Texas right now. On January 30th of this year, we announced 2 confirmed cases of measles in Gaines County. Earlier in January, 2 measles cases occurred in unvaccinated residents of Harris County. So y'all may have heard about those. Those were travel-related cases and didn't spread to anybody else. And so that is separate from the outbreak that we've got going on in Gaines County. And so the cases in Gaines County related to the outbreak I'm talking about started near the middle of January, but it was diagnosed and then announced at the end of January. So, and these were the first cases that were confirmed in Texas since 2023. Now, both of those initial Gaines County cases were hospitalized, and they recovered and then were released from the hospital. They were both in school-aged children. They were from Gaines County, but were hospitalized in Lubbock, since a lot of people do seek their health care in Lubbock. That's where these initial cases went as well. Since these initial cases, an outbreak has continued in the South Plains and Panhandle regions of the state. So DSHS has a regional office in Lubbock. We are continuing to support the South Plains and Panhandle communities in coordination with the South Plains Public Health Department and the Lubbock Public Health Department through our regional office and our central office here. We're actively monitoring the spread of the disease and preparing for potential future outbreak scenarios. And we're doing these plans in coordination with public health partners, like our local public health partners out there, as well as the Texas Division of Emergency Management. If you flip over to the next slide, it shows a map. And so this is the confirmed case count that we announced on Friday, and the counties of residence for those confirmed cases. Over on the left-hand side of that slide, you can see that we've shaded the counties where those folks come from. You can see that outbreak is happening. It's really centered around Gaines County and those surrounding counties, but we've also identified cases in other counties in that South Plains and Panhandle region. We currently, over the weekend, have had more confirmed cases, and so our case count is now at 158 rather than 146. The same 9 counties are still involved, though. That has not changed. If you go to the next slide, this shows the measles cases by age group, and what you can see is that highest bar there falls in that 5 to 17-year-old age range, and so most of the cases, I should say, of all the age groups, the most have been found in that 5 to 17-year-old age range. At first, it was most of our cases were in this 5 to 17-year-old age range. Since then, we've seen it moving into younger age groups, and so we're now having increases in that 1 to 4 year age group, as well as that infant age group of less than the age of 1. If you go to the next slide, this is just a breakdown of this particular outbreak, the hospitalizations that have been associated with it. So on the far left, it shows the age group, and you can see it's broken down into those, the infants, 0 to 6 months and 7 to 11 months, and then the 1 to 4 year olds, the 5 to 17 year olds, which is that school age range, and then older individuals or adults. And you can see the cases broken down by those that have been hospitalized hospitalized, those who had needed admission to the intensive care unit, and those who sought care only in the emergency department and did not require admission. But what you can see is that there have been people going to the hospital that have had severe enough disease to go to the hospital, be admitted, and be admitted into the ICU. And most of this is occurring in Lubbock. If you go to the following slide, this shows our 2025 Texas Measles Outbreak response activities. And so I'll go through some of the activities that we have initiated and continue to support. So in that first group, it shows measles specimen collection sites. We know that getting specimen collection and getting those specimens to a lab is really important. We do a lot of the testing here at our public health lab in Austin. We want to make sure that that happens quickly. And so we have set up 7-day-a-week specimen collection sites and 2 sites in this outbreak area. We also have 4 strike teams that can collect specimens. They can go out and collect specimens if that's more convenient for where we're noticing cases or suspect cases. For laboratory capacity, as I mentioned, most of those tests had been coming to our DSHS public health lab here in Austin, and we have a fairly quick turnaround. There is commercial labs that can do it. They just have a longer turnaround, and so we've been trying to direct a lot of them here. Because this outbreak is happening out in South Plains and the Panhandle, we have asked our laboratory response network partner, and so it's Texas Tech, who runs a public health lab out there, asked them to also stand up testing and have given them all the support and supplies that they need to do that. They should be standing that up this week for local testing to be done. We're also working with El Paso, Tarrant County, and Bexar County to bring up measles testing in their public health labs to make sure that we have got capacity all across the state to do this testing quickly. We've also increased our own capacity at our lab here in Austin to make sure that we can run them quickly when we do get specimens. On the next slide, you can see the title, Access to Vaccine for Individuals Who Want Them. So we know that this vaccine, MMR, is highly effective at preventing measles. After the first dose, it's about 93% effective. After the second dose, it's about 97% effective. And because of the effectiveness of that vaccine, the United States was able to declare measles eliminated in the year 2000. And so this vaccine, like I said, has a long track record as well. We've used it for over 50 years. And so we know that this is a primary component of outbreak control and preventing outbreaks across Texas. And so we have stood up vaccine clinics that are operating 7 days a week in sites there in the outbreak area. We've also been accessing vaccine resources from CDC in order to push out through our existing vaccine programs, so Adult Safety Net and Texas Vaccines for Children. We have specific outbreak vaccines that we can use in this outbreak area for people who don't fall in, vaccine providers who don't fall into one of those networks. In addition, we've purchased other vaccines for other circumstances. We just want to have vaccine available for whichever providers can give those vaccines, especially in that outbreak community. But now we have communities that have experienced exposure of these vaccine cases as well. Of these measles cases as well, and we want to make sure that we've got vaccine available when they need those anywhere across Texas. And so we do have 5 deployable vaccine strike teams that can also go outside of the clinics that we've established and get vaccines to places where they need it. Under that, there's access to post-exposure protection to prevent illness. And so if somebody gets exposed to measles, there's a couple of ways that we can try to prevent it. And so we can try to get them a vaccine within the first 72 hours. And that can sometimes prevent disease in them. If it doesn't prevent it, it can at least make it more mild. And so we try to get vaccine out as fast as possible if somebody's been exposed. If we don't hit that 72-hour window, occasionally we can also give immunoglobulin injections. And so this would be particularly for those babies who are under the age of 1 that are really susceptible to health complications. And so we are making sure that we have purchased more of this immunoglobulin and that we have positioned it out in the South Plains region so that we can prevent those really vulnerable Texans from getting sick. If you go to the next page, it talks about surge staffing to assist with specimen collection, epidemiology, and vaccination. So we have deployed a lot of our DSHS staff. So we've sent staff out to this outbreak area from our central office, as well as our other regional offices across the state that aren't experiencing this type of outbreak, and made sure that our partners out in the South Plains region have resources. So our DSHS employees have been doing that. We also have 27 contractors that are beginning today there in this outbreak area to assist local public health departments. We've also requested resources from CDC, including physicians and epidemiologists, to help with case investigations and hospital exposures there in the South Plains region and in Lubbock. Furthermore, we are doing messaging to ensure that individuals know that there's a measles outbreak going on and that we've got vaccines available. And so we've done public awareness efforts to cover the Panhandle and South Plains region. That initial education will include billboards and social media messaging, and that has started this week. CDC has been supporting us in that as well. And DSHS can expand education efforts to other regions across the state as well if it becomes necessary. On the next slide, I talk about awareness and education for providers, schools, and local health departments. So we have issued health alerts to ensure that providers are aware of this outbreak. We're holding regular webinars through Texas Medical Association and Texas Pediatric Society. We're working with Texas Hospital Association and Torch for those rural hospitals to make sure that people know what's going on and know that they can call on us if they have any questions or need any help. We're also working with school districts and local health departments. We're helping with hospital planning. We have done a call to hospitals across the state looking at their pediatric bed availability. We're starting hospital reporting this week using a platform called EM Resource, and so that we can look at those pediatric resources from across the state, including pediatric ICU beds, to make sure that we are prepared to take those patients if Lubbock becomes overwhelmed, that we know where we can transfer patients for that higher level care. And then we are, on that last slide, coordinating with appropriate state and federal agencies. So we've been working closely with Texas Division of Emergency Management, had multiple phone calls with Mike Morath of the Texas Education Association, and so working with TEA and TDEM. We have also been working with CDC and federal HHS and to see how they can best support us in these response efforts. If you go to the final slide in that packet, it shows kind of what our expectations are for this outbreak. So due to the number of suspect cases that we have right now, we do expect more confirmed cases to occur in this outbreak. We know of other outbreaks that have happened in the last 10 years across the United States have lasted months, some of them as short as like 2.5 months, but like the one in New York lasting about 10.5 months. And so that this could go on for a while until we are able to fully contain it. Some of the other expectations is that children who test positive for measles, as well as those who aren't vaccinated and get exposed to measles, are excluded from school due to the contagiousness of that disease. And so we are trying to work with TEA to try to minimize learning loss that happens there and loss of school funding. And then we are concerned about our MMR coverage across our state, knowing that it's lower than some other places across the United States, and that this particular region has lower vaccination rates, but that there's some areas in Texas that have very high vaccination rates, high enough to protect their communities. And so really watching that, but knowing we need to really be on the offense of offering those vaccines and getting education out so that parents can make those decisions to protect their family and their kids. And that concludes my presentation about measles, but I am happy to answer any other questions that y'all have.
Okay, thank you. Members, questions? Representative Busey.
Thank you, Mr. Chairman. Commissioner, thank you so much for your report, and it seems like your diligent work to try to contain this. This is the biggest outbreak in Texas in over 30 years, isn't that correct?
Correct.
Can you talk about why that would be happening now? What's going on, especially if we've eliminated this disease in 2000?
So the continuation of elimination of measles depends on having a certain level of immunity in a community. And so we've been getting that through vaccine. Usually at about 95%, we have what's called herd immunity. And so if one person brings in a case of measles to a community, there's just so much protection there that it can't cause an outbreak. But we know when those vaccine levels get lower than 95%, that there's enough unprotected people together to cause an outbreak or to allow an outbreak to happen. And so this was merely an introduction of measles into an area where there are pockets of lower coverage of that measles protection.
What's the trend? I mean, if this hasn't happened for 30 years like this in Texas, are we no longer vaccinating Texans? Is that what's going on?
As I mentioned, there's some communities across Texas that are highly vaccinated, above that 95% threshold. Here, there have been, in this region, some decreasing vaccine coverage rates in recent years.
Is that because we don't have enough vaccines, or what's going on that's causing that trend?
No, we have plenty of vaccines and make them widely available through our different vaccine programs so that people who have insurance coverage and those who don't or are underinsured have access to vaccines. And so we're making sure that happens. But there has been just some decreased interest or distrust in vaccines, and that's caused a decrease in vaccination rates.
And okay, so let me ask you this. If people don't get vaccinated, they're not just putting their own health at risk for this? What are they impacting their community? Can you talk about how that impacts, how one person choosing not to get vaccinated can impact their neighbor?
Sure. So we know that for the most part, when people get vaccinated with one dose, it's 93% effective, and when at that second dose is 97% effective. But we also know there's people within a population who don't have a great immune response to vaccines, and so they're not going to get that full protection. We know there's pregnant women whose immune response goes down a little bit during pregnancy and can't be fully protected. And those babies who are less than one that don't usually get vaccinated. And so there's vulnerable people within a population that can become infected if the other people within the population don't get vaccinated.
So just to understand, if someone chooses not to get the vaccine, not because of health reasons, but they choose not to get it living in a denser population or community, they're not just impacting their own safety, they could be impacting the safety of their neighbors and their community. Is that correct?
They're allowing it to be able to spread to other people.
What do you need from us as the legislature? What can we do? Not just policy, but what do you need from your elected leaders to help stop this?
So we are going to continue to do what we're doing, including messaging, but we are actively trying to get local health departments and local healthcare providers and local leaders to help with some of this messaging to their communities. They know their communities way better than I know their communities sitting here in Austin. And so looking for people to be good messengers to their communities and help us get this communication out about the importance of vaccines.
Is the MMR vaccine safe for people to take?
So we know that anything that goes into your body, any pharmaceuticals, can have side effects, and that includes the MMR. We know that some people are allergic to MMR, but we also have 50 years of track record on this vaccine showing that the benefits outweigh the risks on this one, and that the risk of measles right now is pretty severe. We already have a child that's died. We've got over 20 people who have been hospitalized just within this outbreak, and so the risks of getting measles are real. And this is a vaccine that we've had for years where we know the benefits of this one.
So you need us to help speak up to our constituents about why they need to get this to help.
I think that would help us contain this outbreak.
Can you real quickly speak to what the case that just happened here in Austin in Central Texas, and is it a standalone case or what's going on there?
It's a standalone case associated with travel, and that also happened in Rockwall County, I believe. And so there's been a couple of these, and those two that I mentioned from Harris County, where they were travel related. They came back, but they didn't contact other people who were unprotected or unvaccinated, and so that outbreak didn't spread, or it didn't cause an outbreak. Those cases didn't spread further, where what we're seeing out in the South Plains region is that is within this pocket of unvaccinated people, and it is spreading.
Well, thank you so much for all of your efforts. And Mr. Chairman, thank you. I hope this committee can help lead in the awareness campaign around this. Thank you.
Thank you. Representative Simmons.
Well, thank you, Rep. Busey, for answering asking all of the questions that I needed answers to, so I appreciate that. So I'm good. Thank you, Mr. Chairman.
Okay. Representative Frank?
Thank you, Chairman. Just a couple quick questions. Of the folks that have been confirmed with measles, were any of them vaccinated?
Yes, some of them were vaccinated, and that happens. Not everybody who's vaccinated will get that full response. We know that some of their immune systems don't respond as well. We also know that some of those got vaccinated very recently, and it could have been during this response time where they got it as post-exposure prophylaxis. So we're still trying to separate all of those out.
Okay, thank you. Because I'm trying to, and I want to be careful the way I ask this, because I think the measles vaccine is, proven and something we need to push and or encourage, maybe is a better way to say it. It seems to me we have the most recommended vaccines of any country in the world, pretty much by far. And there's a bunch of reasons for that. Some of them good, some of them not, in my opinion. It seems like some of them are truly vaccines, truly keep you from getting something. Right, and then some of them are almost like pre-treatments that we're pushing as vaccines. Am I wrong on that? And I probably should have asked this offline. We're just, but hey, I'm going to ask because I think some of it, the distrust is caused, I think, in some parts, rightly or wrongly, by perceived information or sometimes actual misinformation coming from people in authority. And so I'm trying to figure out, like the measles vaccine seems a very clear case, something we should do. And then yet there's other things that are called vaccines that sometimes I don't think operate like vaccines, don't keep you from getting it, so.
Yeah, vaccines are really complicated.
Well, I feel like we need different words for the
ones.
different vaccines.
Yeah.
Like some vaccines are really vaccines, really keep you from it. And then some are not quite as much like
So
that.
this
May still be
particular-
necessary, but.
This particular vaccine is a live virus vaccine. It's a weakened form of the virus, and it causes a really strong immune response that can last for the rest of your life. And so it's one of our really good ones, where things like the flu vaccine or the COVID vaccine don't provide that same level of protection. A lot of what you get there is just a less severe illness when you get infected, and so, there's different perspectives or goals of these vaccines for sure.
Well, I think it's funny, you said something very interesting. This is one of our really good vaccines, but yet we use the same word for all of them, and then we wonder why we're confusing people. And because there is a significant difference between like this that clearly needs to be done in the vast, vast, vast majority of the cases, and others that maybe it's just better, worse, personal choice. Am I off base on that?
I think there's different, the risk-benefit ratio on these are different. And so you're right, like some of them are much more clear. But I think that's how those recommendations are formed. It's just if the benefit outweighs the risk. But there's this huge spectrum, right? And I think
this is where the subtlety is lost on most people because it's either you're either for every vaccine or you're an anti-vaxxer, and I don't think that's where most people in the world are actually residing, or maybe there are too many that reside there. But I think there's things that go on the risk spectrum, and clearly the measles in this particular issue is one where we have the history, we know the science behind this, but it's hard for people to understand the difference when we're calling it all the same thing, in my opinion.
And we will be working on communication of all of these as well, so thank you.
Thank you. Representative Johnson.
Thank you, Chairman. And Chairman Franks, thank you for those highlight on the efficacy of the measles vaccine. There were a couple things that I thought were missing in the presentation, and no criticism, but I want to make sure as we're having this discussion about public awareness that people are really clear about what we're talking about in MMR, measles, mumps, and rubella. So measles, because you've got all the symptoms and everything that can happen here. You also highlighted the fact that vaccine is the best way to prevent. But I want to talk about when people get sick. There's no treatment at that point, correct?
There's
You
some
can get
data-
vitamin A and be put in a hospital,
Yes.
but there's no give me the pill now once your
no-
child is sick.
Yeah, I'm sorry to interrupt. Yes, there's no antiviral that's specific for measles. There's supportive care, including some data behind vitamin A, but that's after you get sick. It's not preventing it, it's after you're already ill.
And so that's why we're seeing children who can die that this idea that I'll just let my kid get it, they'll build up immunity, we'll be fine. You said 20% of these kids are ending up in the hospital.
Correct.
And in fact, when we look back statistically with where we were in measles, back in the United States, when we started tracking it back in the 1950s, and then into the 60s, we were looking at, like we saw in COVID, multiple spikes up and down, and we were getting 700,000 cases, correct, at a time.
Every person was getting infected by adulthood, basically, almost every individual living in the United States.
And then vaccines were licensed in 1963, and over the next decade, we saw that drop significantly, almost to nothing. And as you said, in 1971, we all got one shot. Mm-hmm. And that's, I've heard 90%, I heard you today say 93% effective, correct? And so for folks like me, who were a child in the 70s and early 80s and got my vaccine, I've actually only had one. And so there is an argument that some folks may need to get a boost and get that second dose, correct?
That's correct, especially in these areas where there is an active outbreak going on.
Because that 6% of efficacy can make a big difference in healthcare, especially when we talk about herd immunity, correct? For those that are after 1989, they got 2 doses.
Exactly.
And the nice thing about measles is once you get that treatment, you're really done, except for those very few 3% cases that may contract it and get it. And so the nice thing, again, about a measles is in 2000, we started to eliminate this disease, and it hasn't really changed. It's one of those that's pretty stable and secure, and we know what happens, right?
Yes.
So in 2004, in 3 and 4, in Texas, we saw 2,314 religious exemptions as reasons not to get the vaccine. To date, that number has continually climbed to now that we have 118,572 people claiming religious exemptions for purposes of not getting a vaccine. Do you think that those are purely religious, or do you think that misinformation and disinformation and illogical causes around the lack of understanding of science can cause to the contributing factor for people claiming to need an exemption?
So it can be for a reason of conscience, but I don't know any specifics beyond that, just that we get that exemption or information about that exemption from the school districts.
And as you said, if it gets to 5%, we lose herd immunity in the entire county, right? And these dark blue sections are showing almost 35 counties at least that are getting close to that tipping point in the state of Texas. Is that your awareness?
Yes.
All right. I want to talk about some of the disinformation and misinformation, and not that people, I get it, people are worried and they're concerned. We've heard people say MMR can cause autism, and I think you said it's safe, we recognize it's safe. So there is a distinction for folks that have an anecdotal story of, hey, I got my baby vaccinated between 7 months and a year, and then my baby started showing symptoms or signs of things like autism or other genetic diseases that don't present themselves until about that time in fetal or infant development, correct?
Yes, so studies that have been performed looking at any link between those have found no link between autism and MMR or any other vaccine.
Thank you. And so, as a leader in the state of Texas, you are letting people know the rhetoric around autism and MMR is not accurate. Mm-hmm. This is a safe vaccine. We know about measles. We know that measles can cause high fever and brain damage. We know that kids can die. I want to talk about mumps. Mumps equally, 20% of boys that get it will get such swollen testicles they'll get infertile. Correct?
I don't know the exact statistic, but absolutely that is a complication of mumps.
So if you don't get your little boy vaccinated for MMR, roughly 20% of them may not carry on the family genetics, right?
Yes.
Let's talk about rubella. Rubella, if a woman gets rubella, 70% of them are going to get arthritis, right? And if a pregnant woman gets rubella, there's significant risk of blindness and death, intellectual disabilities, liver and spleen damage to their child.
Correct. Congenital rubella syndrome, yes.
So that's the real implication of us as a state of Texas not paying attention to the public health necessity that we all do our part to get our kids vaccinated, because it's really our kids that are suffering. It's not much of a choice for that kid, right? And so another disease that has been almost eliminated is polio. We also see vaccine hesitancy that carries out not just from MMR, but can affect polio.
Correct.
And we now have an outbreak of polio in New York.
There have definitely been cases in New York, and they have identified it in the wastewater there. So it appears that more than just one person has it there, yes.
And so the time to talk about the efficacy of vaccination, to calm people's fears, to not use illogical rhetoric, but to let people know this really can become an even bigger public health crisis than what we're talking about today needs to be taken seriously. And I'm so grateful that you're willing to come in and talk about that.
Absolutely.
Thank you,
anytime.
Doctor. Thank you, Chairman.
Thank you, Representative Pearson.
Thank you, Ms. Schufert, for your update. Just wanted to sort of expand a little bit on what Representative Frank said with regards to the communications and what we are talking about versus what we're not talking about. And I just wanted to go back to something you said about MMR being safe and used for over 50 years now. And my point is really one about clarity. Are you saying that the MMR vaccine is the same today as it was 50 years ago?
Yes, there is one formulation that's the same as it was all that time ago. There have been two other formulations since then that they're all part of this, though, live attenuated virus vaccine that is very similar to the one that was done over 50 years ago.
But they're not the same. They're different today than they were 50 years ago, just different variations.
One of them is the same, and then two additional ones aren't quite the same.
But when we're saying MMR,
Yeah.
we're speaking of them broadly to include all of them.
Yes, that
Okay.
is true. Yep,
Okay.
you were correct about that.
And then are we tracking the efficacy over time of the different variations of MMR?
Yes, we continue to follow the effectiveness of those vaccines over time.
And they're generally the same.
Yes.
And so would you mind providing that to the committee? So that when we are looking at the effects of MMR and efficacy,
Yes.
what we're actually looking at?
Absolutely.
Because Representative Frank actually told us that some of these people were vaccinated that
Yes.
actually came out with
Yes.
the with the disease. So I'm just curious. Well, yeah, you let us know after the question.
I did say that, yes.
And I think that's very important because getting vaccinated, if we're using the term vaccine, doesn't necessarily mean you're not going to contract the disease. Is that correct?
That's correct.
Okay. So I think it'd be helpful if we could look at that data.
Sure.
Thank you.
Just to clarify, I think she said it's